Hello, I'm speaking to you from my office and following this month's board meeting which took place in Tatchbury Mount. And as always, I just want to take this opportunity to update you regarding the board meeting and highlight some of the key issues that we discussed. It was the first board meeting when we were joined by our two new non-executives, and they are Michael Bernard and Kate Fitzgerald. Michael has an IT background and was working with IBM before he retired, and Kate is a barrister by trade and has worked for a large financial institution in the City of London. They both hit the ground running and I'm sure will make a really great addition to the board and indeed the wider trust. It was also good that we were joined by a number of colleagues from across the organisation in the audience. I think probably more colleagues than I've seen previously, which was lovely to see, and again I would encourage you to try and attend a board meeting if you can at some point in the future. Our patient story also featured a member of staff, and that was Emma Ladder, who's one of our speech and language therapists from Lymington, and Emma was joined rather by a patient of hers, a relatively young woman who experienced a stroke and suffered significant speech difficulties as a consequence. And actually hearing about her journey of recovery was heart-moving. She was accompanied by her partner and they spoke very powerfully about the challenges they'd faced. And I think it was really good for the board to hear about the important work that our speech and language therapists do and the key role they play in providing high quality rehabilitation to both patients in our hospitals and also obviously in the community. We heard about how the Trust has now become smoke-free at long last. As of the 1st of this month, we are now officially a smoke-free organisation. I know this is not without its challenges, and a lot of work's gone in, particularly in our mental health units, to ensure that we are ready to be smoke-free. There will be some colleagues who will have reservations about this, and obviously will highlight the importance of patient choice. Given the fact that our mental health patients often die early in part as a consequence of smoking and smoking related disease, I do think it's the right thing for us to do and is very much in keeping with national policy. There's an expectation that all hospital sites are smoke free, so it's something that we have to embrace. We talked a lot about the culture across the organisation and the importance of developing a just and fair culture. It's something I've talked about in my latest blog and something that Paula Hull will now be leading on in her capacity as Director of Nursing and Allied Health Professions. So watch out for posters and communications about this in the weeks ahead. We also highlighted that it's Mental Health Awareness Week this week, which is really important, and it's important that we continue to raise awareness of mental health problems, not least amongst our own staff. There will be many colleagues out of the 6,000 staff that we employ who have significant mental health problems, and I really want Southern Health to be a gold standard employer and for people's work to actually enhance their mental health and not have a detrimental effect on it. That's a challenge for us and is very much part of the organisational development strategy that Paul Dracos is leading. We touched on the documentary that you might have seen on Sunday evening on BBC Two, the Louis Theroux documentary, which focused on maternal mental health problems and featured our own mother and baby units in Winchester. I think it's been a very positive piece of documentary filmmaking, and certainly the feedback I've seen in relation to it has been very positive, and I'm very pleased that we're now having more positive stories in the media about the Trust's services, and a big thank you to Tom and the communications team for making that happen. On a slightly more downbeat note, not surprisingly, we spent a lot of time talking about the number of patients that we continue to have out of area, and I'm talking about our mental health patients. As of today, we have about 60 patients in hospitals other than those run by Southern Health. Quite simply, that's not good enough. We have to improve. It's a real focus for the operational teams that are now up and running across our 5 divisions, particularly the 4 geographic divisions. We do have some good plans in place, looking at alternatives to inpatient admission, looking at improving staffing in our inpatient environments, and I'm expecting to see those plans have a real impact on the out of area problem in the weeks ahead. and you can rest assured the board will be keeping a very close eye on this issue. We also received the annual complaints report. It's an important document. We need to learn from the complaints that our service users and patients make about our services. I think what's encouraging is that we're seeing more issues dealt with as concerns at a local level rather than being formalised into complaints. And that's how it should be. We need to be responsive and people need to feel able to talk to people informally to get the issues which are concerning them addressed quickly. The other positive was the number of compliments we are receiving as an organisation, which is now just short of 6,000 a year, which is a great number, and certainly we are seeing a significant year-on-year increase in the number of compliments, which I think reflects very well on our services. But as always, there's more to do. I think that's about it really. I was checking my piece of paper. You might have seen my piece of paper where I've written my notes down. All in all, a good meeting, a lot of important issues covered. If you have chance, the board minutes are available on the website, and as mentioned, our next board meeting will be in July, and it would be great if you could come and join us. All the best. Thank you.